and we're going to keep moving forward with our next speaker. So I would like to introduce you to Dr. Stuart Garber. And John, I'm hoping that you can highlight Dr. Garber for us. And just want to briefly tell you a little bit about his amazing background. He practices holistic medicine. He's been doing that since 1981. And he became the first person in the United States to receive a PhD in homeopathy. And he has so much experience as the past president of the California Homeopathic Medical Society. He works with lots of different organizations, including the New Mexico Center for Therapeutic Riding, which works with equines. And he works with Assistance Dogs of the West with our amazing canines. He maintains a private practice, he teaches, he writes, and he also conducts research in dietary supplements and homeopathic remedies. He's certified in animal chiropractic by the American Veterinary Chiropractic Association. So please join me in welcoming Dr. Garber. Hello, Dr. Garber.
Hi, good morning. Just want to make sure you can hear me okay because I'm back from the computer a bit so we can have a demonstration.
Yeah, if you don't mind just speaking up would be great, but we can hear you. But yes, it sounds good, but any elevation would be appreciated.
Okay, I will speak up. I also want to mention that for the purposes of this presentation, questions can come as we go and not necessarily be held to the end because it might be more appropriate to be able to stop what I'm doing and answer a question while I'm showing what I'm doing.
Okay, awesome. We will keep an eye on the chat and we will let you know as questions come in then. Thank you for giving us that opportunity.
Okay, so what I will be speaking about today is how to keep your dogs at peak performance and also how to help them age more gracefully and allow them to be as in good physical shape as possible. Now, I do a lot of different things, but there are four main modalities that I use when I'm treating dogs. One is chiropractic. Two is what we call photobiomodulation. Many of you may be familiar with the term laser therapy. Well, what laser therapy and all different kinds of light therapy are doing is modulating the biology using light. So there's the term photobiomodulation, or we just call it PBM. Another modality that I use quite a lot is kinesiology taping. I don't know if any of you are familiar with that. I'll just show you. It's usually a little box like this with a roll of a special kind of tape. And I'll be demonstrating this on our star here, which is not me, it's Sophie. And I'll introduce her in a minute. And then the fourth modality I use are supplements that are based on plant stem cells / homeopathy. And I find these to be extremely valuable. In fact, I developed them myself because I wasn't really happy with what else was out there on the marketplace for keeping our dogs' joints healthy and also to have them stay calm and happy when we need them to be. So I would like to see, I don't know if we can do this by a show of hands or yeses in the chat box, how many people are familiar with chiropractic? Maybe Marcy can give me a count. Is it most people, some people?
Yep, we're getting some yeses, absolutely. And
Okay.
Dr. Garber, we're also getting some comments from people that your background is blurred and it's really hard to see you. So I don't know if you have that option on your, if you checked that, if you intended for it to be blurred
I
today.
did. I thought you said you wanted us all to blur our backgrounds.
Oh, well, everyone except you. You looked great in our practice the other day. Yep, if yes, just click on that start video and then it
Is
will
that
let you
better?
perfect. Yay, that's so
Okay.
much better. Thank you so much
All
for
right,
doing
terrific.
that.
Okay, Sophie. Hey, baby. Okay, so this is Sophie, and she's also a rescue dog, as are all of my dogs are rescue dogs. And look at the picture. Hello, there you go. And I'm going to show you a little bit of how I approach a dog to evaluate them chiropractically. I usually just start on one end and work down to the other and feel what's happening at the pole, in her neck, see how motion is doing. Of course, this is, if there's any particular area that needs attention, I'll usually look at that first. But what I did want to emphasize in today's presentation is that a lot of times people think, oh, chiropractic is for, well, with humans, it's for bad backs, but we think of it in animals, it's for injuries. And what I'd like to get across today is that what chiropractic is really about is freeing up interference of from the communication from the brain to the rest of the body. So we're not just talking about the musculoskeletal system, but we're talking about the organ systems too. So by doing chiropractic on anybody, any animal, we can affect the heart, the lungs, the thyroid, the pelvic organs, digestion. So it's not just for, oh, this animal got injured, he needs to be adjusted, she needs to be adjusted. It's like, well, this animal is throwing up all the time. Maybe it's a problem with the nerves that go to the stomach. This animal's having trouble breathing. Maybe it has to do with the part of the spine where the nerves that go to the diaphragm are, and so on. So that's very important to understand. Okay, so then we just go down the spine, feeling for places where there's restriction, okay? And where there's restriction in the motion of the spine, there's interference with the nerves at that level, okay? So that's why it's so important. Now, the most important tool I have for chiropractic is my hand, and usually I can make an adjustment to the spine that way. But we also have a tool here. This is a little adjustive tool, and we use that a lot for different areas of the spine. And if you're not familiar with this, it's just a little percussion instrument, and it uses speed rather than force to make the correction. Okay, good girl. Good girl. Okay, so does anybody have any questions about that before we move on? No? Okay. So this is one of many types of devices for photobiomodulation. And
Dr. Garber,
yeah.
we do have a question.
Oh, great.
Yes, the participant is asking, how are you sensing a blockage? How do you know that there's a blockage?
Oh, I'm actually moving the vertebra, each joint, whether it's a vertebra or a joint in the extremities, and feeling if it's not having its normal range of motion. So I can come down. What I'm doing right here is I'm actually moving each individual vertebra of her spine to see if it's moving properly. Okay. I also can take the extremity, take it through different ranges of motion, see where it's moving, where it's not moving, and that's how we know where the blockages are. Does that answer the question?
Thank you.
Okay.
Yeah, and we have another comment. They said that participant said very helpful. Thank you. And we also have another question that says, please detail how important the normal range of motion is to proper muscle, nerve, and biomechanics is.
Detailing it, that participant just said it in in a better way than I can. It actually, proper range of motion, proper joint function allows for optimum nerve input to all the different parts of the body. So whenever there's any kind of issue, it can affect every other part of the body too. In fact, when there's a problem up here at the top of the neck, that alone can affect everything from there down, because that can create interference with the brain sending signals to the rest of the body.
And
So,
that really ties in with a question too that was just posted about how do you know if lack of movement is a physical problem or just the dog resisting? And then they also
wow.
added when palpitating their limbs. Yeah, we said questions and now we're getting lots of questions, Dr. Garber. Yeah, we're
No,
all
that's good.
curious
That's
about
good.
this. Yeah.
How do you know? You know from experience. When I'm working with any animal, and I know that they can probably move further than they're moving, and I want to make sure, it's very simple. You take a cookie and you bring it over, and you'll see that head come way over, and you'll know that they were just resisting, and it wasn't a physical problem. And if they can't reach the cookie, um, then there's a physical issue going on. So cookies are very important to this work, or carrots when working with horses. Okay. Anything else? I see
Um,
popped up.
Yep, I think oh, yep, something did just pop up. I assume we shouldn't do the adjustments ourselves. Are animal chiropractors pretty common around different parts of the country? How do we find one?
That's a perfect question. Um, the American Veterinary Chiropractic Association is the main certifying body for animal chiropractic. You have to be a licensed chiropractor or a licensed veterinarian to become a certified animal chiropractor. And if you go to their website, there's a find a doctor, and there are certified animal chiropractors in pretty much every state. So hopefully there'll be one close enough to where you are. But yes, it really, and there are people who put themselves out as animal chiropractors who are not certified, and I really frown on that, because it's just not good for the profession, and you don't know what you're getting. Okay, good. So getting back to for the biomodulation, this device, some devices just have one frequency, and honestly, there are very good home versions of these light instruments that you can get, for a few $100s, and it's really not a bad thing to have on hand, because they're very, very helpful for reducing pain, reducing inflammation, and intracellular healing. This one happens to be a little has a lot of different features and uses different colors of lights, and I think you'll be able to see that when I so you could probably see that. I have this set just for a setting that so you could see it. But the animals, it's very interesting. The animals really like the way this feels. I'm going to do there's a
Dr.
setting specifically for pain using just the red light. It's a
We
steady
have
red light.
another quick question, Dr.
Yeah.
Garber. Wanting to know what is the name of the instrument that you're using?
Well, I mean, there are so many. This one is called the Visum Light, VISUM. This unit is about $2,500, so a little bit pricier. I mean, there are types of lasers that go up to $10,000, but I don't think that's anything that is really necessary. One thing I found about using this instrument or any of the similar types of instruments is that regardless of what time you set on it, if you want to do a 3-minute or a 5-minute, when the animal is done, they move away from it. I find that very interesting. So they'll be like, oh, this is good, this is good, this is good. And all of a sudden they'll just move away. I trust them. I turn it off at that point. I don't make them come back for the extra 30 seconds or whatever we're missing. They have an intuitive sense of knowing that it's good for them. The pain relief is pretty remarkable, just on a red light pain setting. But they have models that you can change, set all kinds of different frequencies, and it's all very good. And this is something that you don't have to be licensed to use. You can buy it on your own, any of these models. But the research on photobiomodulation is pretty amazing in terms of what it does in terms of cellular healing. Okay. So any other questions regarding?
Just one more, and that is that people are wanting to know the name or the link, so that they can check out this product that you're using.
I think if you just, oh, let me see. There's that. I bet there is. Oop. I believe it's just vismlight.com.
Okay, thank you.
And that same company that makes that also makes a smaller model that doesn't have as many bells and whistles, that you'll probably be able to get to from their website. Now, kinesiology taping, we'll move on to that if there are no more questions. Let's see one more. What's that?
Yeah, we found the URL. John just posted the URL for Vism Light. We're all over it, Dr. Garber. Everybody's curious. Thank you.
All right, this is great. Kinesiology taping is just a fantastic modality. I use kinesiology taping on myself, on some humans, on dogs, horses. It's just really incredible. There are different ways of taping for different types of injuries. And you've seen this, I'm sure you've seen athletes with all this different colored tape on them while they're performing, because not only does it work for injuries, but it also works for performance enhancement by increasing proprioception, which is your body's sense of position. So a lot of athletes wear it. You'll probably see it more on the type of sports where there's more skin showing, like beach volleyball. But athletes use it all the time for, as I said, for athletic performance and for injury treatment. Just to save time, I pre-cut some pieces off that roll to show you how you might use it. So come up, so okay. So what it is, it's a special kind of tape. It's not like the kind of tape you used to see where it holds a joint in place. This actually allows for motion. It's a very flexible tape, and it brings it brings the skin up, which allows for increased blood flow and lymphatic flow in the tissue underneath to decrease pain and allow for new nutrients to come in and for healing. So on a dog, where we're going to put it on her fur, it will lift the fur. And sometimes people say, well, it's just sitting on top of the fur. What's going on? It's happy to be doing anything. But by pulling up on the fur, it's then pulling up the skin underneath. Okay, sit down. So I'm just going to show you how we do it. It's very simple. And kinesiology tape, there's all different brands, and it's available online pretty much everywhere. And this is something you can all do on your own if there's an area. Let's say she's got a sore spot right here on her spine. So the easiest way is to take the backing of the tape. We're going to put it right across there where the pain is. And you just rub it down and it sticks. And then you take another piece You don't want to touch the tape because it'll lose its stick. That's why I'm holding the backing paper. And you put it right across. And I'll get a better shot of here in a second so you can see it. And Sophie, let's just show people. Can you see that? That it's just a cross. And then occasionally, it might take a third piece and come across and make a star pattern. Okay, is that clear?
Yes. Mm-hmm.
Okay. And I'm telling you, sometimes it just, within minutes, the dog will start feeling better. And you can see how it's lifting up like this. It's still very effective. Now, another, sit down, Sophie. Sit. She's like, my time is up. I want to go away. I want to show you another type of taping. And this type of taping, I'm just going to put it here so you can see it, but it's especially good for areas of inflammation. So if there's swelling, okay, you go right to the area where the swelling is. And you see I've cut strips to make a fan. And we're just going to go down like that. And actually, when you buy kinesiology tape, there's usually an instruction that shows you how to tape for different joints and different types of injury. But I just want to show you this because it's really unique and it'll bring down swelling sometimes within minutes.
And
you do this fan like that, and then you take another one.
when you're ready, Dr. Garber, we have a couple other questions for you.
Okay, let me just tape this up and so you can see what it looks like. And I've seen like a big hematoma that happened from a dog getting kicked by a horse, just literally go down in minutes. Okay, so that's how you work with an area of inflammation. Okay, questions?
Well, one question that's come in that I think a lot of us are having is when the tape is removed, does it take off the fur?
No,
Okay, so it's
I'll show you right here.
okay.
You
And
just kind
how,
of, can you see? You just kind of
yes,
feather it a little bit, and there it goes.
Sophie seems fine with it.
Yeah,
Okay.
it doesn't hurt. I mean, it's like a Band-Aid too. If you just rip it, it's good. But if you feather it like that, it comes off very easily, and all the fur is there.
And
Doesn't.
how long do you leave the tape on typically?
I leave it on typically until it starts pulling off on its own, and then I replace it if it still needs to be replaced.
Okay. And we have a couple of other thoughts from Linda. She's wanting to ask if you would please talk about how canines and animals are vibrational so they don't have all the chatter about whether a modality will work or not. And then her second question is, does the tape have nanotechnology within it?
Okay, I'll start with that one first. Not that I'm aware of. I'm gonna let you down. Not that I'm aware of in terms of nanotechnology. It's working on a cellular level, so it's allowing basically allowing the body to use its own devices to heal itself. Like I said, by changing the compression of the area underneath the injury to allow for proper blood flow and lymphatic flow. And this is what allows the healing to take place. And what was the first question? Oh, about the basically the baggage, if that's the word you were using, Linda. Yeah, animals respond so much better to all of these modalities um, because they have no preconceived notion about what it's doing and if it's going to work or not. Um, yeah, it's just it's really beautiful to see how quickly animals respond to this kind of therapy. And I still have more to go with this, but I just wanted to share that the modalities that I choose to use are not all the ones available to us. There are other really good modalities um, for our dogs and for our animals companions, like acupuncture, other types of body work. Um, there's another colleague of ours, Melissa Campbell, who does amazing body work for ADW dogs. Um, so those are all, I mean, there's kind of no end to what we can offer them. These are just the modalities that I find most useful in my practice. Then I want to talk about the plant stem cell based formulas. So, you know, stem cell therapy has been something that is more popular these days. I'm actually having stem cell injections on one of my knees, and it's doing great. I developed these formulas about 15 years ago because I was really unhappy with what was out there on the market for things like joint products that people are more familiar with, like glucosamine and chondroitin. I'm not crazy about CBD products in general either, which have become very popular lately. What these formulas use are, they're made from the new growth parts of plants, the buds and the shoots and the rootlets, and the parts of the plant that once they're active ingredients in those parts of the plant, where once the plant matures, they're not even there anymore. So it is like stem cell therapy. And we have different ones that can affect different parts of the body. So this one here, which you probably can't read very well, the name of the product line is Maxwell Pet. But this is a hip and joint formula, and I use that not from young dogs, injured dogs, aging dogs. It works both curatively and preventatively. So this is something that I think can help our dogs have strong, healthy joints and bones
Dr. Garber,
throughout
I
their life.
I'm
Yes,
sorry to interrupt you, but several of us are wondering if Sophie is trying to tell you she needs to go out.
she just wants to go out because her brothers are on the other side of the door.
Okay. Okay, well, you can't, thank you. We
But
just
I
had
want
to
to keep her here
ask.
in case I need her again.
Thank you.
It would be pandemonium here if I opened up the doggy door. So,
Okay, thank you.
all right,
We do have another question too
sure.
that's come in, and that is people are asking how to make appointments. How can they reach out to you?
Oh,
Um,
you could uh, email or text me. Probably texting is just as easy. I'll give you my number is area code 310. That's 310-804-3811.
Great. I'll put that in the chat. Thank you so much.
You're welcome. And another formula that I put together also that I think that I know Sophie had some before we started here is based on the same concept of the plant stem cells. And by the way, there are also a couple of other homeopathic ingredients that are in there to round out the formula that I was trying to create. And this one I call Calm and Happy, but it is just that. It's a kind of an anti-anxiety formula. Actually, it's based on the formula I created for humans for anxiety and depression. But it really helps calm animals down. So if they're in a, and it's not a drug, and it doesn't sedate them. It just takes away some of the extra angst. and it would be very good in a lot of the situations where you're at. I know as highly trained as the dogs are, giving them a little extra oomph before they go into a stressful situation could be very, very helpful. Um, when I have animals that are anxious about getting treated, I give them some of that before I start the treatment, wait a few minutes, and usually, as anxious as they are, they're very calm down. I do that with horses as well. Soak a cookie in the formula and then give it to them and wait a few minutes, and then they're ready to be adjusted. So that's the kind of the sequence of things that I do. Uh, yeah. So, any other questions?
So they're asking again, what's the name of the product?
Oh, so the name of the product is Maxwell Pet, Maxwell, and then PET.
Okay, great. Thank you. And several people are putting in about how they like calm and happy, and how that's been really helpful especially with other anxiety, like from thunderstorms and
Okay.
other types of. And where can we get that product, Dr. Garber?
Basic online. Um, if you go to maxwellpet.com,
Okay,
or also on Amazon.
great. And we also have another question about what are some ways besides limping that we can tell or sense that a dog is having pain?
Okay, that's a good question. Panting, and she's not in pain, she's panting because she wants out. Yes, if a dog is panting, um, sometimes if they won't eat is a good sign that they might be in pain. Um, and it doesn't have to be where they're actually limping. They just might not, they might be hesitant to, let's say, jump up on a couch or jump into the car or out of the car. Um, and that's a very interesting one because jumping, they're two different things. Usually jumping out of the car, if they're hesitant to, it's because it's either a neck or shoulder or upper extremity, front extremity issue where they're hesitant to land on it because it'll hurt them, even though if they're not showing signs of pain otherwise. And jumping into the car is often something more in the mid to low back, or in the hips, because that's where they're pushing off and they're extending their spine in order to get into the car. So those are good signs as well.
And there's another question.
Mhm.
After adjusting an animal, do you find that you need to see the animal regularly afterwards to keep them in line?
It's also a good question. It depends on what the problem is. Sometimes if it's an acute injury and it's not too severe, sometimes one session is all that it takes. Occasionally it takes a few. It's never like, if any of you have experienced going to a chiropractor yourself and they say you have to come in 3 times a week for 4 weeks and blah blah blah. It's not like that with animals. They respond much quicker, much better. And then of course there's, that's for let's say an acute injury. For a chronic problem, they might need to be seen more regularly over time. And then there's, which I always think is terrific, is maintenance care once there's no other issue, and you want to just use that as part of your health regimen for your animal, is to have regular chiropractic care. It might be, once every 2 or 3 months, but that's also very helpful in keeping the animal healthy.
And then another question is, how about rest after an adjustment?
Yeah, I usually like the animal to take the day off, the day of the adjustment. If there was a lot that needed to be done, um, and the animal is usually very active, I try and keep the activity to a minimum the following day. But then after that, they're usually free to go do what they normally do.
And another question is, most of us get our dogs around the age of 2.
Mhm.
When would you recommend adding this in as part of their health regimen for
Right,
wellness?
right about 2. Seriously, I'm not being facetious. I think that's not too young to start on this kind of activity.
And would
Um,
you recommend like once a month, once every 2 months,
well,
once a
for
quarter?
a young dog like that, I would say once every 2 to 3 months. You know, if
Mhm.
they are having issues, um, yeah, not very frequently. But then as they get older, I mean, now Sophie is a special case because we got her when she was 2, and we had just moved to New Mexico, and we had to go back to California to close on our house that we had sold there. And we didn't know what to do with her because we hadn't been here long enough to have found a sitter. So we brought her to a place. At the time, it was called Dog Vacay, and I think they took over. It was taken over by a company called Rover. It's basically a kind of an Airbnb for dogs. And we left her and a couple of her brothers there, and she got away. And long story short, she was she was run over by an SUV and but rescued by somebody. We were already halfway to California by then, and she was, she obviously survived. She was taken to an emergency room, and they stabilized her and taken to another place in Albuquerque for specialty surgery. And so she had, aside from a broken pelvis and a luxated hip and a macerated left front leg, um, when all of this was healed, she had become incontinent, urinary incontinence. And as long as I adjust her pelvis weekly, just about weekly, she doesn't pee in the bed, doesn't pee everywhere. But if I don't, then sure enough, it's going to happen. And this goes back to what I was talking about, how the adjustment can affect the internal organs as well as the musculoskeletal system. Her leg just her wrist had to be fused. So she doesn't have the bend in it. And so she lands like head on like this instead of like this. So that impacts her shoulder and her neck all the time. So that gets adjusted regularly, usually almost weekly. And then she gets laser treatment, like I was showing you, on that leg as well. And as long as she gets all of this, she's fine. Otherwise, she's a very happy, healthy dog. She just has these issues. So that's the one extreme where her treatment needs to be weekly or more or less depending on how she's feeling.
Mhm.
My
We have about 5 minutes
Okay,
left, and Linda has put a comment and a question in the chat about sharing with everybody how you work on puppies if they have an injury with ADW. And it's important, Linda's saying how important it is to be mindful that their joints are not fully developed and
right.
they can easily get injured through play. And she's
Mhm.
asking if you would tell us about working on ADW's youths like Bruce and Dan.
Okay. The first thing you have to remember with working with those puppies is that everything takes twice as long because because they're so much fun and you don't want to stop. But yes, because their joints aren't fully formed and they're so playful and they're active and they're always doing something to themselves, and the adjustments have to be tempered um, to account for the fact that the joints aren't uh, fully formed and that they're more apt to be injured. So the adjustments are much lighter than I would on a full-grown dog. Um, but other than that, that's basically you just have to, and you have to understand that after you make an adjustment on one of these dogs, you really have to keep them, especially quiet for the day. So because they'll just go right out and slam into each other and injure themselves again.
And again, just to follow up on that, what signs and symptoms should we be looking at as they are so young? We think of them as, being such young and bendable and
Right. I
Yeah.
would say with all of those young ADW dogs, Linda, it's always you recognize something. This is where you see, oh, they're limping. Um, their gait's off a little bit. They won't jump into the cart, that kind of stuff. It's not a matter of, oh, this one's not eating, because that's kind of more what you'll see with a deeper pain than just, kind of injuries that come with
Mhm.
kids playing.
And we also have the flip side of that, as you talked about the youngsters, what about senior dogs, our retired facility dogs, the
Well,
older
that's
ones?
what it's, yes, the senior dogs, they need to have um, the right supplement, like the hip and joint product. Diet is really important too, and I didn't mean to exclude that. Um, as far as keeping our dogs healthy, diet is probably the most important, and proper veterinary care. I don't want to exclude the vets, but I like to do things as naturally as possible. My dogs and my horses practically never see a vet because they don't have to. But when they do, it's important to have good veterinary care. But the seniors, they need to be adjusted. Also, you don't use as much force. Their bones might started to be a little osteoporotic, have lost some density, so you can't just like plow through on them. You have to be acknowledge the fact that they may have some arthritis in their joints. Um, but it's just as important that they get adjusted regularly um, as any other stage of life. Maybe even more so when they're older.
Thank you so much, Dr. Garber. Any other questions? I know the clock is ticking, and I also put Dr. Garber's text and phone number again in the chat so that if any of you want to reach out to him, please feel free to. Thank you so much for being with us, for you and Sophie,
Mhm.
for being with us today. We
And you see
appreciate.
her, she's
Yes, she's very happy
on her
girl.
throat.
Yes. Yes, we appreciate all the work you do with ADW on our dogs. Thank you so much, Dr. Garber.
Okay. Bye, everyone.